That includes pre-testing counseling. So part of that protocol is to evaluate if that person has any clue about the disease. Were they adopted? Have they seen someone with it? Are they having a major affective depression or even a reactive depression at that time? So before we get the test results, they're evaluating that.
I see. Okay. So, and is this all done in the clinical setting around at the hospital? So after the person goes home, who are they in touch with at that point? They have social workers like yourself who are seeing them through this process?
The hospital social workers, myself, we recommend that people participate in family counseling, support groups, online support, to give them a whole team of support.
Right. Because I imagine it would be hard on the entire family, not the individual certainly going through a crisis, but I imagine the whole family is as well. Because, you know, it probably presents practical issues and emotional issues, I would think.
Absolutely, and the whole disease is really affects whole family systems. And so that's for, multiple generations and at times when people are going through genetic testing and diagnosis as well. So it absolutely impacts whole family systems.
Okay. All right, well, we talked a little bit, you mentioned the Huntington's Disease Society of America, so let's take a minute to find out a little bit more about that group. So do you want to tell us about that, Virginia?
Sure. So the Huntington's Disease Society is one of the largest, or is the largest, nonprofit voluntary organizations dedicated to improving the lives of people everywhere affected by Huntington's disease. So not just the person with Huntington's, but the caregivers, the people at risk, and the siblings, etc. It was started by Marjorie Guthrie when she discovered that her husband, Woody Guthrie, the folk singer, had this disease and nobody really understood it. She did a lot of advocacy, she did a lot of education, and she actually started it in her kitchen in her apartment in New York City, put an ad in the paper, calling all family members with this to come and meet. So years later that evolved. That was the Committee to Combat Huntington's Disease, but it later became the Huntington's Disease Society of America. And we have 46 chapters and affiliates throughout the country. So those chapter and affiliates are comprised of voluntary board members, family members, healthcare professionals, local business people, raising funds and awareness. And the funds that we receive, we use for research, to fund research towards a cure. We provide a lot of education. We are very happy that recently we have gotten, and I know Dr. Frank was involved with the CME credit approved course for physicians for Huntington's disease that they can take online. We download publications from our website. We have a physician's guide to managing Huntington's disease. We have other publications families can have. And we do education in all-day conferences locally, nationally, and we have 100 to 200 people locally, and then we can educate a support group of 5 or 10 people. So we're very dedicated to that, as well as nursing homes. Karen goes out to many nursing homes and adult daycare settings, because some people have one person in the facility with the disease, and they really need a lot of help understanding how to best manage that person. And we also have support groups and social workers throughout the country. We do advocacy, and recently we're very pleased that a lot of our advocacy efforts that we've been working on for a few years is starting to come to fruition. So the first one is the Compassionary Allowance Act, which essentially allows people with Huntington's disease to have their cases reviewed in an expedited manner by the Social Security office. So I'm not sure if you're aware, but some people, once they're disabled or once they lose their job and need income, it can take 6 months or longer, depending on the state they live, just to have the case reviewed. So they are looking at an Emergency Allowance Act that was approved for juvenile Huntington's and now adult Huntington's, so that they can have their cases reviewed quickly. So we're very pleased with that, but in addition, we are working on the Parity Act, which means that once you're approved and considered disabled, you still need to get the funding, and there's a 2-year wait to get Medicare and disability benefits. So the Parity Act is asking to eliminate that 2-year waiting period. As you can imagine, with a disease with all these symptoms, they certainly don't need the financial hardship added to their problems.
Right.
And the Parity Act is twofold in that in addition to eliminating that waiting list, it also wants to review and update the guidelines Social Security uses to determine that someone is disabled. Right now, those are outdated, and they look at the physical symptoms, and they don't look at the cognitive and emotional challenges. And as Dr. Frank pointed out, those oftentimes can be as disabling, often are the reason someone is no longer able to work. So we're working hard and hoping that as we continue, we'll achieve that as well.
Okay. So one thing Virginia brings up too is the talk about long-term care, and I just want to ask, like, at what point does that become an issue for the patient and the family, and how much input does the patient usually have? I mean, is the patient able to contribute to determining what that long-term care is going to be, what it's going to look like? And does that vary from case to case?
It definitely varies from case to case. When you look at nursing home data, the average amount of time before someone, between diagnosis and they go into a nursing home, is about 9 years. Again, that's average, there's a wide range, and that's just nursing home care. Many times people need more care at home before that, and people can stay at home through the end of life as well, depending on family support, nursing support, different types of insurances and what's covered at home, how much home health aid time they can get. So it really depends on the individual situation.
Okay, okay. So, but do you find that the patients usually contribute to the discussion in terms of what's going to happen? I mean, or is that, I don't know, I'm
I
just
think
asking.
that you're raising a very good point, and we always encourage people early in the diagnosis to start looking at what we call advanced directives.
That's what I'm thinking,
Having
yes.
conversations with their family and their doctor about choices of what they would or wouldn't want, because down the road people might lose their ability to speak, to be understood, or to make difficult decisions. So we want people to begin these conversations early, to choose a healthcare proxy, to discuss would they want a feeding tube or not, would they want hospice, nursing home, home care. So we do bring it up early to people just to start the ball rolling, as we know that when it comes time to make that choice, the person might no longer be able to communicate.
And this is actually a very important public health issue too. This is not just for Huntington's disease, this is everyone.
Right, right.
I could be hit by a bus tomorrow, and my wife knows what I want in terms of feeding tube, resuscitation, what type of care. So this is something that everyone should really have a discussion and have it written down and share it with someone who they trust.
Right, right. It doesn't just pertain to somebody who's facing this
it happens
this
that
diagnosis.
in Huntington's disease, you know if you have the gene that eventually you're going to develop the disease, and it is fatal. So these are issues that are going to come up on a timeline that we can, generally speaking, predict to some degree. For many people we can't, but it is important for everyone to have this in place.
But I think one of the challenges, and I'm sure you see this a lot, Dr. Frank, is that with Huntington's disease, there's a certain number of people that are not able to recognize that they don't want to get tested, for one thing we mentioned, but also some people who get tested, it's actually a neurological and sometimes psychological denial, or not being able to perceive that their symptoms are getting worse. And therefore, they're not apt to accept that they need help in the home, a nursing home, or want to address a feeding tube and these issues.
That's a very good point, and that those turn out to be very difficult cases when people don't have insight. There's both denial in terms of what's happened in the family on a psychological level, but also a lack of insight. People don't see what's happening to themselves and what's going on around them. And those are the cases that are very difficult, as you point out, because they don't accept the help that they really do need.
Right, right. They think everything is just the same as it was a couple of years ago maybe, or they haven't changed at all because they haven't seen the changes. And
they don't recognize it in themselves.
Right, right, right. And to be honest, I find that sometimes whenever you're dealing with a sick person of any kind, depending on the person and the sickness, but you don't have to have a terrible disease not to be able to recognize what's kind of going wrong.
True, and on some degree with chronic diseases there is adaptation. People do make small changes, and what we perceive may not be as bad as what they're actually feeling. We know that's true in Parkinson's disease. There are well-established studies with that, but Huntington's disease is a little different. They truly have a lack of insight. They don't recognize what's happening to them. People could be falling out of their chair because of the amount of chorea, and they don't recognize that they have any chorea.
I see, okay. I think, one thing I found out while researching this is that they usually have a greater need for calories. Is that right? Because of the movements and all. I don't know if that really is relevant at this point. But it seems ironic to me in a way that but then they lose their ability to swallow.
Yeah, those are very good points. So we know that weight loss is a major issue in people with Huntington's disease, and that can be even before the movements start. It's true that the more you move, the more energy you're going to burn,
Right.
and so you do need more calories, but there may be also something about the energy-producing parts of our cells, the mitochondria, and that's where some of the research is focused, is on that area. But because of that, people do need higher calorie intake. And it's more of an issue as the disease advances, and as you pointed out, with swallowing becomes an issue, and getting the calories in, both time and swallowing, because it takes longer for them to swallow. So that's why it's important to have a discussion about feeding tubes.
Right.
Often when people stop walking, because they're burning less calories, they can actually pick up some weight then.
Oh, okay. I know that we're running short here as time's going along quickly. What about the future? What does the future look like in terms of research, genetic research? What's going on?
So it's a very exciting time in Huntington's disease research. Funding overall for research right now is quite down, unfortunately, but because Huntington's it can be a great model for Alzheimer's and for Parkinson's, there's actually a lot of research that's going on right now from a genetic standpoint, from understanding the disease to treatments, genes. There's new medications that are in the pipeline. There are different gene therapies that are being worked out, different cell-based therapies as well. So there's more in the pipeline, and more pharmaceutical companies and biotech companies that are interested in Huntington's than ever before.
Well, that's a very positive result of all this, isn't it?
It is.
Yes. Okay. So do you predict where we're going to see the biggest leaps? Will it be through some sort of gene therapy or through the medications?
Well, we're closest with not gene therapy per se, but affecting the genes in something called silencing RNA, or small interfering RNA. And there are two different approaches right now that are very close to being developed in humans for human clinical trials.
Okay.
So I think that's probably the closest right now.
All right, well, that's very positive. One last thing I want to ask Virginia about is you have some walks coming up in the next couple of months, so you want to tell us quickly about what?
Absolutely. First of all, we're always looking for volunteers and board members, so you can call our office. The phone number is on the screen. We have a walk on September 15th in Lowell, Mass. At Heritage State Park. And they're all 3-mile walks, and we have one at Castle Island on September 8th in Boston. So they're all 3-mile walks. Everyone gets a t-shirt, you collect pledges, and if you go to hdsa.org and click on Team Hope, it'll just click on Massachusetts and you'll be able to get to those walks.
Okay, and I think there's a listing too for events coming up or something, so
yes.
Maybe that's how. Okay, so what are the dates again for those?
So September 8th for Castle Island in Boston, and September 15th for the one in Lowell at Heritage State Park.
Okay, so I hope that people will take a look at that and
Definitely.
hopefully become involved. Do you have any last thoughts before we close our program today that you want to convey to our audience?
We have lots more information on our website. We've recorded webinars, complimentary books and brochures, and I can come out to local facilities or home care agencies and offer free staff training. So we'd love for people to learn more about it.
Okay, okay, and Dr. Frank?
Well, I mean, I think that it's important in terms of education and getting the word out there about what Huntington's disease is and how to address many of the issues. And there are many families that feel very isolated, but there's a lot of support and information that's out there and available for people.
Okay, so just get in touch with the Huntington's Disease Society of America, and that will get you in touch.
And people should also know that I personally think this is one of the most devastating diseases, and any disease, of course, is a big challenge for any family member. But when people support HDSA and a cure, the research that's being done will, in fact, help other neurodegenerative diseases, so they can be helping lots of other people as well.
Right, okay, so it's not just for one disease that the research will benefit. Okay, well, I want to thank you all for coming here today. It's been very informative. I've learned a lot here about Huntington's disease, and I want to thank you as well for joining us this evening. And I want to mention to please check out the Huntington's Disease Society's website and find out more about those walks, and also look for our second program that we'll be doing on this subject, where we look at a family and see how it's affected, how Huntington's disease affects those who have to live with it on a daily basis. Thank you again for joining us, and I hope we see you again next time.